Hello, dear
Hello.
Professor Kondo. We are here in Vienna for the 12th World Congress for Neurorehabilitation by the WFNR. What is your first-hand opinion of the event so far, and have you participated in any previous editions?
Oh, yeah. The overwhelming area in this conference is stroke and its various treatment related to neurodevelopmental. Worldwide, 50 million people are diagnosed with stroke every year. 5 million die, and 5 million are left with some sort of disability. However, I believe that we should consider about neurorehabilitation for children with autism and related developmental disorder. We have about 5% of population who has developmental disorder, and care must be taken in account for them. Because if we do not so, it produces an amount of social impact, such as increased crime rate through the conduct disorder, and also increase in unemployment due to the depression or other style of psychological disease, which is caused by psychological trauma, growing up and misunderstanding of their nature. Okay.
Okay. And what do you believe is the overarching theme, the general theme of the WFNR Congress for this year?
The sophistication of the treatment, such as the dosing of method of botulinum toxin, the way of neuromodulation, and personalized use of robot for motor learning will be an impact to young generation because they can use them with more feasibility in neurorehabilitation.
From your perspective, what is the role of hybrid multidisciplinary events in developing neurorehabilitation research and practice, and which similar avenues are worth exploring?
Okay. Fundamentally, rehabilitation medicine needs a multidisciplinary approach where top-down style leadership would not work, and under the various situation, every person in team has to take responsibility in order to demonstrate leadership when they have opportunity to do so in individual situation. Taking responsibility, the leader of team at that time must have the ample and the newest knowledge of neurorehabilitation, especially for the stroke treatment. Okay.
Okay. How is robotic training perceived and accepted by patients?
Yeah, in Japan, robotic training is performed under the cover of public health insurance, and the fee for it is set at quite low level. So many patients accepted it with expectation that they can receive the treatment, something new with extremely low cost. However, I believe if the payment level is set at the balance to depreciate the cost of robot, there will be the patient who wants to decline the robot training, or in the insurance system, the application of robot itself might be limited in order to reduce the social cost of medicine.
How long should training courses for medical staff on using robotic technology should last, and what should this be?
As regards to wearable robot developed for the walking of stroke patients by Toyota Motor Company, it needs overnight training for 3 days in order to be an official leader therapist. For other robots we are currently using, usually after the instruction on how to use it, performed by a robot company, I feel it necessary for a couple of months to use it properly. the largest problem to get familiar to the robot, there is not clear guideline to apply robot to each situation. That is different patient by patient. Accumulation of knowledge is necessary, and one day we will have a conference to look up the appropriate way to apply the robots. Okay.
Okay. This was the interview. Thank you very much, and thank you very much for being here.
You're very welcome. Thank you very much.